dilation being absorbed by the J part of the zygapophyseal joint, the fact that at the best, the straightening, lumbosacral junction never even gets to the straight position, even in full flexion. Now then, these fell on the floor this morning as I was coming out, so let's just leave extension for a moment because I can't just straight off the bat. Let's go into rotation, which is an important motion, and look at the instantaneous center of rotation. This has been stated variously, as being the posterior part of the disc at L4, kind of like the typical level at 4-5. Do you remember that the original thing of in Kapanji's book, what Kapanji did was took the zygapophyseal joints like this and drew a circle of which that was the circumference, on the circumference, and placed the instantaneous center somewhere up here. Now what would happen if the instantaneous center was up here? When you rotated, the body would be swinging over like this, wouldn't it? Totally impossible. And yet for many years this was just accepted as being where the instantaneous center is. If it was there, when we rotated, we'd just have a movement round the zygapophyseal joints, but we don't. We have a different movement on both sides, don't we? On one side it compresses, and on the other side it gaps, which means that the rotation isn't with these on the circumference. It's at some point which is producing an asymmetrical movement on the curve of the zygapophyseal joint. Now then, when we talk about the absorption and when we talk about what actually happens, you all know this, of course. We rotate, here is the axis. Now, what is the significance? On which side do we get the compaction and on which side do we get the separation in the zygapophyseal joints? Is when? So I'm rotating left, let's say. Okay, and the left side is gapping, okay? What's the significance, Steve, as far as the intervertebral foramen is concerned under those circumstances?
It closes down the side you're rotating to.
That's right. So the one that there is the gapping on closes that intervertebral foramen. So this is a sort of concern that we have when we're producing rotation. But rotation is an ideal way of getting maximum separation between the plates of the facet. And here's a very good example where we change the axis of rotation almost to this side as we gap this one open here. Now, what's the relationship of how the whole segment absorbs rotation between, let us say, the neural arch mechanism here and the disc mechanism at the front?
The disc absorbs a third, because the neural arteries absorb 2/3. So
Yeah, you see various figures. Sometimes you see 50-50, sometimes 60-40. Depends to some extent on what? It depends on what position the spine is in, doesn't it? And if we're sort of flexion of the spine, even though we know it's only straightening, we don't have such a complete approximation and congruency of the facets, which means that there'll be less ability of the facets to absorb rotation, so it throws it onto the disc, which is why the disc gets injured much more in flexion rotation strains, because this is not working as well. But to produce movement of a stiff facet, or movement of a facet where we perhaps have an incarcerated meniscoid, that little rim has kind of got trapped, no question. The $1 million roll is the big technique, the rotation technique. And we've been, to some extent, a little bit leery of always doing it, although in a study that was done by Cassidy at the University of Saskatchewan, taking patients that had proven CAT scans and manipulating them with rotation. None of them did any worse, and most of them did a lot better. There were 14 patients, 13 did better in 3 weeks. The interesting thing was that the CAT scan only changed in half of them. The others had exactly the same CAT scan, but symptomatically they were incredibly improved. And they were doing rotation manipulations with proven discs on CAT scans and neurological signs. And everybody kind of improved. So perhaps we've been a little overcautious sometimes, but still, I think we're erring on the correct side here. Now then, let me just speak Yeah, I'll just use this one, which has got both of these on, because this is a different figure here. Okay. This is the rocking backward movement that we see, and we see that there will be a maximum contact here, but the upper part of the facet now gaps open. I know we've had someone in Canada talking about different tests you can do to see the significance of this. I didn't understand it. You know, to know whether we would even be able to sort of ascertain that's happening. But, you know, we sort of talk about close pack coming back like this, but we realize now that this principle of close pack doesn't always work. Because certainly the ligamentous structures posteriorly are going into a slackened position. Maximum congruency is achieved at one point, but then it rocks back on this point and starts to gap open at the upper part of the facet. And of course, one of the problems with extension is that it's also going to take this superior facet, or the superior facet of the inferior vertebra forwards and into the intervertebral foramina, and that's what can cause lateral compartment entrapment if this gets very sort of slack. Now then, let's talk for a few moments about coupled movements. We've got all these kinds of different terms out there: congruency of movement, or coupling of movement, and non-congruency of movement. That seems to be, I think Earl brought that out, and it seems to me to be a very convenient way of looking at this. Now then, what are your ideas on what happens here in terms of congruency and non-congruency of movement? Because this is what's going to relate to how do we lock joints, so-called, or lock levers, so that we can force everything to one joint. What's the answer to this?
What's the question again? Just
what is congruency?
Knowing which components go with which, like knowing what rotation goes with side bending.
Yeah, okay.
Or with forward bending.
So we've got coupled movements and we've got pure movements. The pure movements are flexion and extension, and should not have any side bend or rotation unless there's something wrong with the segment, when it will, and that's the principle of muscle energy classification. But when we side bend, we get an automatic rotation. Okay, now we'll come to just discussing which rotations and side bends take place. Let's take the lumbar spine. Anybody like to have a go? You going on, Brian?
Is that debatable? I mean, I think that in Level 2 we found that it depends.
On what?
On the person. And it obviously depends on how you have that segment positioned in the flexion or extension. Mm-hmm. But it also depends on the individual.
Okay. And then the question is, what difference would it make? It would just mean the difference between a movement we thought was non-congruent happens to be congruent, but we still get locking in a congruent way. And I'll try and go over the synonymous terms with you here, because sometimes, although we use terms synonymously, I don't think each term is equally appropriate in terms of what is going on. So let's just put those on the board and see what your things are about this. We've got to have some system, because we can't hold, part of the spine in one position and then the next segment down in the opposite position while we get to the next joint down. That's just not possible. So we're going to have to make a little bit of a compromise. And I think what Brian said is quite right. But I think we can generalize sufficiently to be useful to us. So coupling will be dependent, certainly on the position of the spine. It's going to vary between flexion and the movement in extension and the movement in the neutral lordosis. And then from most of the studies that we see, in terms of movement, very often what occurs is a thing called a paradoxical movement, where all the bones seem to go forward and one seems to tilt back. And this may be somewhat related to instabilities and just the way that the body is trying to handle that particular segment. But we can't take all these into consideration when we're actually trying to set anything up. So, what's the standard understanding that you have at the moment of just generalizing a little bit, or are you not prepared to do that? If you're not, I will. Just out there what the general consensus is. We know we've got a problem at L5, possibly at L4, less argument down to L4-5 than there is at L5.
So you can generalize that with flexion you have side bending and rotation at the same time.
Okay, I think that's reasonable. Did you try testing all these out? And what did you come up with? Were you smart enough to feel anything? Well, we'll have to sort of see, because I'd like you to just do some of this. So flexion, we have side flexion, rotation. So we'll put it down what's happening. In flexion, if we side flex left, a rotation to the left occurs. Let's go now into neutral. What happens here? Side flexion left, rotation right. Then we come into extension. Side flexion left.
Same side from the osteopathic view.
Okay. The North American view of this is that side flexion would go to the same side. The rest of the world view on this, that's only the osteopathic view. The rest of the world view is that it would go to the right. And anyway, when we start looking at the locking techniques, these are the principles that we will base all of our findings on. This is an opposite movement in extension. Okay. What we'll do is look at the rest of the spine, but not just at the moment. You remember with Friot's laws, Friot said that the important thing, and these were not laws, of course, they were hypotheses, but they became laws. And it's really interesting, if you look back and you see where it all came from, a medical doctor in 1905 called Lovett did a number of experiments with an osteoligamentous preparation. This means that all the ribs were taken off. Of course, the person was dead and all the muscles were stripped off. So all we had were ligaments and bones. And then somebody gets hold of the thing with calipers and starts to twist it like this. Now, we don't know whether all of these twists would be exactly the same as we could do with our muscular system. Halliday came along, who was one of the greats in terms of osteopathic anatomy, and produced the same osteoligamentous preparation, which was called the Halliday spine. And then the calipers were put on, and as a result of that, Lovett came up with his rules. And he said that what really matters is what is happening to the zygapophyseal joint or the facet joint. If it's under load, either by being bony impaction or by being capsularly stretched, rotation and side bend will always take place to the same side. And he called that his type 2 law. If the zygapophyseal joint is in its neutral position and not under load, side bend rotation will take place to opposite sides. And that's what he called his type 1 law. But this has not been the sort of general feeling out there, certainly in terms of some of the biomechanicists. Now, we get into all sorts of problems. People like Gratovetski and people like Farfan feel, let's say at L5, side bend rotation always take place to opposite side, regardless of what position you're in. Piercy, who did a whole lot of work with three-dimensional studies, felt that side bend rotation always take place to the same side. Didn't mention neutral, but inflection and extension. But that was at L5, S1. So there is a lot of disagreement out there. But what I would like you to do is to do a little experiment for me. Okay, now we're going to have to do this very accurately to get anywhere. And what I think we should do is to sort of try and do some work in the thoracic spine, because the principles from everybody are the same in the thoracic or in the lumbar spine. So we don't just have huge, great levers to work with. And I would like you to do, and I will try it on Brian, being as he's looking bright today. Come and sit on here, Brian.
Am I lying down? What am I doing?
No, you're sitting up. We're going to do this in sitting, and I want Brian to come right up to the end of the table. These don't tip, do they? Okay. To the end of the table here, all right? And this is the thesis, or perhaps this is the hypothesis, that if we go into a movement where the correct side bend and rotation are occurring together, we reach the end of the range, but there should always be a little bit of complementary extra movement for me to do. In other words, there's a resilience in a congruent movement. But if I use a non-congruent movement, I should not be able to get any extra resilience at the end of the range. So, I'll only do it in one position, and I'd like you to do it in 3 positions. And then if you get any differences from what we're saying, we'll just see how well you're doing the technique. So let's try flexion with Brian. And this will be a very good thing for when we get further on into the techniques. Perhaps I'll just bring you around. Oh, it doesn't matter, Brian, because it's going to be one or the other here. What I want to do with Brian is to take some point at, let's say, about T10, and I want Brian to think about this spot and just slump back a little bit onto my, yeah, that's it, just from there. That's good. So I'm taking this into a flexion position. That's my first thing. Now, having got that into a flexion position, I'm just going to take it off just a fraction. Keep my finger on there, and now what I'm going to do is to side bend down to that point by giving a little bit of a lateral glide to Brian like that. So I'm pushing very slightly that way. So now I've got flexion into it, side flexion into it, and now what I'm going to do, I don't want the shoulders complicating this at all, so I'm going to come around his chest wall here like this, and what I want to see now by putting my thumb on the opposite side of the spinous process to the rotation, let's say that's at T8, T9, so I'm on the left side of T9, and I'm going to see if I've got any resilience there, like that. I want you to feel that. Then what I would like you to do is to ask your partner, let's leave the neutral position out of it for the time being, ask your partner now to go into a very local lordosis, or an extension. So he's just going to sort of let the chest go forward, and just let him go forward into that position till I feel that I'm in lordosis. Back off a little, because we only want the movement to take place at this joint. Do the same thing. I'm going to side bend down by pushing like this, holding him in that lordosis. Now what I want to see is that a stiffer movement, or can I do that more easily? So this is the sort of thing we're going to look at. What rotation goes a little bit easily with that side bend? Can you all understand the problem? And just see what you feel here. Because this is going to be very useful for very localized action when we start working with muscle and when we start trying to do rotational movements at a specific level. This is going to be very helpful. So it's a good exercise in technique anyway. So let's see what the answer is. We will come up this afternoon with a definitive answer on this. Level by level. This axis. Now, we can try this. And as I said to you, if I think people are coming up with kind of like really sort of theories that are sometimes a little difficult, we should ask for evidence. Now, perhaps I'm kidding myself. But if we just look at a patient here and just try this for yourself, okay, just come up here like this. Let's go into extension where the movements are a little less anyway, because of course extension as a movement is much more stable than flexion as a movement. So when we're talking about long levers, if all else is equal, we'd always go into an extension lever because it's just a firmer lever. So let's take extension. So I'll come into extension here. We will side flex to the right, to the left like this in extension. All right, now what I'm going to do is to come back here, have a look at that, hold of that, have a look at this. Now just make sure I'm not cheating. Okay, side flexion to the right, to the left in extension. Let me push back through a chest. Just tell me if I'm pushing too hard on your chest. Okay, there. Okay, or that. That's less mobile than that. There's a little bit of resilience there. There's nothing there. All right, that was doing latection. In other words, preceding the rotation by the side flexion. Now then, what we've got to do now is to sort of say, okay, I'm going to go into extension, I'm going to go into rotation now, so that's rotation into this. Now then, what is the easier movement? Is it if I come down here, or is it going down in the opposite direction? So here we go into that position or that position. And it seems to me it doesn't make much difference whether you precede the thing with rotation or if you precede it with side flexion. Now it isn't, as far as I'm concerned, the principle of manipulating or locking in the thoracic spine. For example, just lay down on your back for a second. If you were in flexion, generally, I mean rotation is one of the key movements here, but you would be into a position here like this. All right, I would side flex towards me now. I'd be rotating that way in flexion. And that is the lock position. And I could then produce a very good movement at that level. Now then, if I actually got her into flexion, rotated this way and did this, all went the same way, it seems to me that I've got much more resilience going side bend rotation in flexion than if I rotate and try that, or I try that. There is no movement there, to me, but perhaps I'm convincing myself because it fits my theory. But you know, you can do this for yourselves, and I think perhaps it's a good thing to sort of just do this. Now, I don't know what difference it makes. The osteopaths in the 1930s came up, Hoover was the one that came up with latection and rotation. In the last 10 or 15 years, the osteopaths have sort of said that this was an antiquated term that they have long since abandoned. But we've resurrected it again in Canada. That's the smarter ones. The old-fashioned guys like me, I'm still a little bit following the old principles. And when I test it, because I've been worried about my understanding of this principle, it seems to me that it doesn't make any difference when we start doing these very specific movements. But you know, to do these properly, you've got to really hold the side bend, or you've got to really hold the rotation while you're producing the other movement. It's got to be a very precise movement. And to do these precise movements, I mean, look at me on Deb here, it's lovely, all right? Okay, all right? But you've got to have your body, and your body matters. You can't do it kind of like this. That's hopeless. You've got to be there, and you've got to be using your body to produce this. So if you're not using these kind of very intimate contact movements, you get all sorts of give taking place that confounds the locking. So I'm not saying this is wrong, I'm just saying this is a different principle which I've not come across in any of the books on biomechanics. Like the latest book by Punjabi and White, I don't remember seeing anything about this. And I did look, but you know, it may be in some part that's not indexed and so forth. You sometimes find these little snippets, then you can't find them again when you want to. But I don't know that this seems to be a very kind of local teaching, and it's very much what is taught in the Institute, but I don't know out there what the evidence is and why it should be all that important for me. So there's a little bit of a difference between, you know, members in the Institute. I know Diane gave this beautiful lecture at Vale, which completely lost me. And I thought, geez, I've got to go back and look at this. So I've got the tapes which David sent me, which I haven't got around to viewing yet. This is the problem with tapes, and it takes such a long time to go through them. Instead of looking at a book, you can kind of whip through them quickly. And that's the next thing, Dave, is to have a laser thing that you can just run it on and just, wow, yes, and it just whips you through to that particular section. I guess that's on laser disc. You can't get that on tape stuff. Any other questions on this? All right. Now then, this would be a principle. Just come a little bit over here. This would be the principle of the upper lever, the cranial lever. Okay? And if we want to produce a movement at a particular level, then I want to have that level to start with in its neutral position, and then I'm going to run my movement. Let's say that Deb here has lost some rotation in flexion. Okay? That means that to get into this L1-2 joint here, I've got to actually produce those two movements. I couldn't, for example, hold her in extension and then in some way lock it there and produce flexion only at this joint. That's impossible. So whatever's lost here has to be part of this lever system. So if flexion and rotation to the right is lost there, then I'm going to use the lever with flexion and rotation to the right. That gives me the possibility of what to do with side flexion. And to lock it in flexion, I'm going to side flex it to the left, which then is locked for rotation to the right in flexion. So that's how we would use non-congruent movement on a long lever to lock that lever. If I didn't want to put too much stress on her, because this is like the first treatment where we use a little less stressful thing, I'd probably use a congruent lever. So I would just go into flexion, rotation, side flexion to the right, so that she's not too stressed out when I do this. But as we get a little bit more specific, then we can side bend, in flexion. I'm going to bring in that rotation now, which shouldn't take place in any way that way, because we've already produced rotation that way with the side bend. So now the first joint that can rotate to the right is the first joint that's in its neutral position, and we can now take it down to that level. So that's locking from above downwards.
So you just flex down to the level here.
Down to the level, yeah.
Down to, but not including.
But not including that level. And then when we do the technique, we've got the lever set up, we flex into that and then do the correct combination of rotation. Yes. Now then, when we talk about the lower lever, I'd like to change the terminology to make it easier. I don't want to talk about congruent and non-congruent movement for the lower lever. It's a complication we can do without. Okay? And what I'd like to talk about for the lower lever is how could we make this stable